Today I'm going to discuss you a possible approach in controlling COVID-19 in Sri Lanka. Why I wanted to select this topic was that as the President of Sri Lanka Medical Association, an organization which has worked in collaboration with the government towards controlling COVID-19 situation, I thought that all of us, that is basically the healthcare workers and the government and the general public, we should have a clear understanding of what should be the future steps that we should be taking together. Therefore, I thought of explaining a simple framework that will help us to understand how we can work together towards controlling COVID-19 in Sri Lanka. And to start with, I had to mention that compared to other countries, Sri Lanka has done quite well in controlling the COVID-19 situation, which is very much obvious in the data. The simple model that I want to explain to you is what I call, there are 3 L's and 3 C's and 3 T's. 3 L, 3 C and 3 T. Basically, this is the 3 L's are for the government and 3 T are for the healthcare professionals and the health frontline, and the 3 C's are for the general public. I will explain one by one. Alright, so let's get back into this simple framework or the model that I was talking about to understand the approach in controlling COVID-19. A very simple framework. 3L, 3C and 3T. And in the center also, again there are 3 C's. What we call cooperation, collaboration, coordination. Because there need to be proper cooperation and collaboration between these 3 sectors. There are 3 sectors. So all are 3's. The government, the general public and the health workers. So we'll take one by one. First, if we take the general public, there are 3 C's. That is, avoiding crowded places, cleanliness, then covering. Let's go back into expanding those 3 C's: covering, clean, and crowded places avoided. Those are the simplest measures that the general public can take from their responsibility. If you have to control COVID-19, these 3 simple measures are the most important. Cover is basically covering the mouth and the nose in the proper way, using a mask. That's very important in controlling COVID-19 because this disease is mainly spread by the infected droplets. Thereby, by covering, first you prevent you getting the infection from others. At the same time, you prevent, if you have the infection, others getting it from you. So that's number 1, very important. Crowded places. Again, worldwide data has shown that crowded places with poor ventilation are the highest risk when it comes to spreading of COVID-19. That was evident in Sri Lanka also. If you think about places like Kandakadu camp, rehabilitation camp, where the infection has spread like wildfire. So we should not go into any kind of misconception that we as Sri Lankans, we are specially protected. It is not so. If the right conditions are given, the disease will spread. Therefore, avoiding crowded places, especially confined crowded places with poor ventilation, very important. Number 3, cleanliness. Maintaining hand hygiene is very important. Again, why? Because this disease can spread through droplets. Sometimes we might touch maybe the surfaces that are contaminated with the droplets, or sometimes if we have the disease, by touching our own mouth and nose, we might be spreading the disease to others. Again, the science has shown that cleaning with soap and water, proper cleaning, or using alcohol sanitizer, is enough to destroy this virus. Again, why? Because research has shown that this virus is covered by a lipid layer. And as you all know, soap can dissolve lipid. So these three simple measures, these three very simple measures are the ones that we need to follow as general public to prevent the spread of this disease. The three C's: covering, crowded places, and cleanliness. Then for the government, again very important, there are three L's. What are the three L's? One is leadership. That's very important, and Sri Lanka has shown that. And good rules and regulations. That's what we call legislations. And legal enforcement. It is not enough having legislation, but the authorities should be able to enforce them also. So from the government side, these three are very important. That is leadership, legislation, and legal enforcement. That is for the government. Then regarding healthcare professionals, again there are three T's. That is what we call trace, then test, and treat. This approach is very important. Some other countries were focusing only on testing. But what Sri Lanka has done was first to identify the contacts of those who had the disease. That is tracing. Tracing is very important because you first identify who has even the remotest risk or the chance of getting this disease. And you separate them. And then only you test. In that way, we are minimizing the chance of the disease spread. Because if we test first without tracing, then you might lose time that might take for testing. Therefore, the first step is tracing, identifying who are at risk, and then testing them and treating them. If they are found to be positive in testing, to treat them. That again is very important. You might wonder what's so much important or so special about treating. Again, Sri Lanka is very special because many other countries, even developed countries like UK, they will not be treating everyone who got infected. Most of them will be advised to stay at home. But in Sri Lanka, if someone was positive for COVID, they will be taken into hospital. In that way, you are separating those infected. Even if they don't have symptoms, still they will be separated. Therefore, you are separating them from the community and reducing the chance of spreading. So therefore, this strategy of trace, test and treat has been proven very effective for Sri Lanka. So this is the time-tested formula that Sri Lanka has followed. The three T's for the health workers, that is tracing, testing and treating. For the general public, covering, cleanliness and avoiding crowded places. Then for the government, leadership, legislation and legal enforcement. All these can be achieved only if there is proper cooperation, coordination and collaboration between these three. And with that, I think Sri Lanka should be able to control this epidemic successfully.